Okay. So we quickly start medico-legal ethics is a very important aspect of healthcare. And before we start, the preamble is that every patient who comes to the clinic is a potent litigation guy in the clinic. So you need to be very careful of what you do in the clinic. You need to be very vigilant about what you do. And the first thing which comes to the mind of everyone here in practice is that documentation. And documentation is the key. We will start with Mr. Agarwal and then we will want his insight on what is the value of documentation when it comes to medico-legal ethics.
I would say it's extremely important, and many times many doctors and hospitals are saved when they have kept their documentation very effective. I also advise many doctors and hospitals in my practice, especially when you have a critical patient or you have a doubt that this patient will become critical, maintain your records properly. Each doctor must say he has seen the patient, what he has found, why he is prescribing particular medication. That is very important for doctors, hospital and patients as well, for taking them data. And in any follow-up disease. So it's extremely important.
Yes. So documentation is a very key important point when it comes to medico-legal ethics. The another aspect is that today when we look at healthcare, it is patient-centric. And each and everybody, right from HIFAA, is saluting people who are in the non-medical background people. They are also equally important when it comes to medical negligence. Doctor, what is, Mrs. Siddharth, what is you were a doctor earlier as well, practicing doctor. So I would like to know what is the, way out for these kind of cases not to spur up and medical negligence, we don't reach that stage of medical negligence, how it has to be contained.
See, I have diverse experience both as a doctor as well as an advocate. So what I can say is that most of the medical negligence cases which evolve is mainly due to resentment from the part of the patient or their family, and that is mostly due to improper counseling. There is some missing touch or verbal communication between the physician and the patient or their relatives. Now what happens is that although there is a medical ethics rules 2002 which was specially formulated and adopted all across the country, but either most of the medical practitioners are not aware of it, or it is sometimes it's very difficult. For example, there is several things to talk about. For example, consent to begin with. So, for example, if a patient enters your room, there are different types of consent. Now, for example, there is a concept called tacit consent. For example, if a patient, a female patient, she enters for USG, ultrasonography of whole abdomen. Although it's a fact that you need to have a female attendant, but besides that, the patient cannot say that the doctor, be male or female, has touched my stomach, because she knowingly enters the USG and she knows that there is a USG of whole abdomen which is to be performed, and in that course her belly or stomach may be palpated. So this is a tacit consent. In the what I mean to say is that you are going inside knowing that what is to be done to you. Now, if there are some non-invasive procedures or procedures which require extensive intervention from the part of the doctor or medical practitioners, there has to be a written consent. Now, consent may be of different types. I am not going into detail, maybe we will discuss later. So, main importance is documentation.
Yes. So coming back to the patient-centered care, and if we don't touch upon the medical records particularly, it will not be justice to this panel. Mr. Agarwal, coming back to you, what is the current status of hospital healthcare facility by large, and what are the records rules in the country.
In medical record, there are so many rules. Medical record is, but one thing which he rightly said, medical negligence arises out of miscommunication, of lack of empathy by the doctors, by the hospitals, and by the staff members. Because we always find, and generally my experience and everybody's experience, a patient is generally treated as a commodity. I don't blame doctors because their first concern is to take care of patient, but generally no empathy is shown to the patient, nor to their relatives, and this disgruntlement take them into medical negligence cases. And that is very important even for treatment, as Mr. Nikki Mehta and others have said. If you create a hope, and if a patient and their relative have a faith towards the doctor, the treatment is better.
As doctors, the thumb line is never hesitate to investigate and keep investigating till you reach the final diagnosis. Because financial burden, there are multiple ways to mitigate that. Today you got Ayushman Bharat, you got Pradhan Mantri Yojana, you got state insurance, you got health insurance, but you should help the family and the patients to reach to a conclusion before you start treatment. That's all from my side. Dr. Agarwal, final words. Mr. Siddharth, any final words?
I will only say you spoke about doctors. Speak something about from patients and his point of view also. How they should be treated in treatment in hospital, because any patient who comes to the hospital or goes to doctor has some trauma. He's suffering. And as he rightly says, he needs to be protected and given hope. And which start from chokidar, nurses, the clerks, and everybody in the hospital.
Very, very valid point. Very, very point.
And
Valid
for
point.
which, unfortunately, there are no standards, there are no laws. I also find there are no teaching in any hospital or any doctor's consultancy. You teach people empathy, your staff people. Starting from chokidar.
Sir, that probably that question did not come from me, because I personally, as a hospital administrator and a group CEO, there are two things which I always find with all my doctors and myself also, that patient को कभी भी hospital से पैसे के अभाव में जाना नहीं चाहिए. I use each and everything which is available under the sun that the patient should get the treatment what they deserve. Number two is that if there is a problem with a patient, it is the onus or the responsibility is the hospital, not the patient family or the patient, because patient is the king when they walk into the hospital. Yes. Any final comments, Mr. Siddharth, and we close this discussion?
I will very short, I will say that litigations mostly are of two types, civil and criminal, in case of medical negligence cases. Now, civil litigations mainly involve what you have correctly said, and others have correctly also said, that is the compensation and amount to be paid, which usually is a civil dispute and mostly comes under the ambit of the Consumer Protection Act.